How's everyone doing on this Friday?
I'm doing all right.
All right, Matt, I
Well,
think we can go
welcome
ahead and get
everybody.
started.
Yeah, absolutely. Good afternoon, everybody, and happy Friday. We'd like to welcome you all to the deep dive with Altum. This is going to be our monthly Lunch and Learn series. The topic that we are covering today is going to be what we've uncovered about disaster recovery prep so far in 2024. My name is Matthew Alford. I am the partner and Chief Development Officer for Altum Healthcare Solutions. But our main speaker today will be Ms. Elizabeth Richards, who is the Chief Executive Officer of Altum Healthcare Solutions. Just a little background on Elizabeth. She has close to 15 years of a healthcare attorney experience that includes third-party liability, workers' compensation, insurance appeals, Medicaid and Medicare, and other complex reimbursement matters. Ms. Richards is also an active member of the Georgia Bar Academy of Healthcare Attorneys, Georgia chapter of HFMA, and she has also been selected to the Board of Directors and Legal Counsel to the Georgia HFMA chapter, and also co-chaired the Region 5 event. Additionally, she has chaired and founded the Women in Healthcare Initiative in the state, and in 2014, she was selected to serve on the National HFMA Task Force for Early Careers. Wonderfully, she also is an HFMA Fellow and holds the Medal of Honor designation. She is a double dog and is just a wonderful person. Personally, she has a husband, Brett, and 2 sons. So that is enough of my side. I'm going to turn this over to Ms. Richards and let her start this Lunch and Learn series.
All right, well, I thought you were going to offer me my first question.
Yes. All right. So here's one thing that has come up here just in the last couple of weeks, which I know most of our facilities are being impacted at. But the last couple of weeks, the biggest news story, especially involving disaster recovery, is Change Healthcare. And for our listeners who might not be familiar with that, can you kind of tell us what's going on and what's occurred in the last 30 days or so?
Sure. So on February 21st, Change Healthcare was the victim of a cyber ransomware attack. It's the largest cyber attack in healthcare history. I have also heard it being called the largest cyber attack in the history of the United States. So pretty big deal. If you're not familiar, Change Healthcare, who was recently purchased by United Healthcare, runs about 15 billion with a B transactions per year through their system, which approximates to a total of about a third of the total transactions for health care in the United States. So it was a really, really big deal when they were hacked by a group out of Russia. They were completely shut down. So as of February 21st, their whole system was shut down and unable to do anything. It actually just went back up yesterday. I believe yesterday was the first time that people were able to at least view claims and Change. I don't think that they're able to submit claims yet. So it was down for a whole 30 days, which was a really big deal for hospitals, doctors, insurance companies, pharmacies. You may have heard about the pharmacy part on the news because that made the news more. But really all those entities were unable to access files, send bills, or receive payments. So it was a really big disruption in the processing of claims for health insurance in the United States.
And Elizabeth, just for our clients, can you kind of explain what the impact has been on the hospital revenue cycle?
Yeah, so obviously any hospital that uses Change as a clearinghouse to bill their claims has had a complete standstill in their operations. They've been unable to submit or review any of their insurance claims, and this is a huge deal, particularly for large facilities that bill thousands of claims a day. It has also completely stopped payments from coming in. So if they were on electronic, all insurance carriers or most insurance carriers now are on electronic payments and remits. And in that case, if they were on electronic payments and remits, they have not received payment. So that's a really big deal for a lot of the smaller facilities in our country who don't have a lot of cash on hand to have their payments stopped. Even providers that weren't directly connected to a change clearinghouse have seen interruption because a lot of the payers use change clearinghouse. So we've seen it even disrupt operations in situations where they were using a different clearinghouse than change. Another thing that has been delayed is prior authorization and utilization review has been delayed. So it's been hard for the hospitals and physicians to get authorization to provide the services they need or to admit the patients in-house. It's created a need for the first time in a very long time for hospitals to consider submitting claims on paper. So if you've been around this industry for a while, you remember the days of the red and whites, the red and white UB form that we used to print on the special paper. I've talked to clients who are literally digging around in basements looking for their red and white printers because we don't use that anymore. We don't do that, particularly post COVID and everyone going at home. We've gone to almost completely electronic submission. So it's been really interesting to try to find ways to get those claims out in paper for the first time in a really long time.
So
Another thing, go ahead.
no, I was going to say, so you mentioned a minute ago that these facilities are just now being able to start billing again. What are you seeing or expecting for these facilities in the coming weeks?
I mean, I think that the biggest thing that we're going to see is if they're able to start billing again and getting remits again, there's going to be a very large backlog of denials. The claims were probably still being denied and processed by the payers, but the hospitals didn't have a way to see that. So we expect there to be a large backlog of denials. We also expect there to be a lot of prior authorization denials because these claims were not pre-certed as they should have been before they were filed. And then the other thing is that there's going to be a lot of issues when it comes to timely filing because the hospital's been unable to submit claims in 30 days. Some of these payers have 60-day timely filing. So if they were running up on a timely filing deadline 30 days ago before the system went down, they're going to have potentially had those claims now delayed and past their timely filing.
So outside of just the revenue cycle, what impacts do you believe that these facilities and the communities are going to be facing?
I mean, the other thing outside the revenue cycle is that, this has really affected patient care. The American Hospital Association did a survey of their membership and found that 74% of their membership was reporting delays in patient care related to this. As I said, you've probably seen a lot of information on the news media has really picked up on the pharmacy delays, patients being unable to get their prescriptions or unable to pay for their prescriptions, or some of the discount cards that patients use to fill prescriptions were also affected and managed by parts of the United Healthcare and Change branch. So I think for hospitals, they are also going to have a higher level of readmissions from patients that haven't been able to get their medicine or haven't been compliant with their medicine post discharge. And obviously those readmission rates impact some of their reimbursement on Medicare claims and health insurance claims. So I think we're going to see a pretty big fallout from this over the next 6 to 9 months that we're not necessarily tracking right now, as those readmissions are increased because patients weren't able to get the drugs that they needed to take safely and be treated safely at their house.
So you mentioned, not only hospitals, but pharmacies and physician practices. And we're, in 24 going forward, and it has been for some time, we've grown to more of a, technology digital age move. What do you think that these facilities can do to be better prepared to react to issues like this in the future?
Yeah, so all of our facilities, on the operational side, we have contingency plans. So you have contingency plans at your facilities if the power goes out, or if there's a natural disaster, or if you're unable to get supplies and things like that. But we haven't spent as much time creating contingency plans in the revenue cycle area in particular. And I think this shows, obviously coming off of the last couple years, first with COVID, where we had to kind of send everybody home overnight. And now with something like this, it just shows that there's a major impact to a hospital's ability to deliver care to its members and its community when something like this happens, when they cannot get claims out the door, we cannot get payment. So really just preparing for this by creating a business contingency plan around revenue cycle functions, which is not something that we have done. We usually have contingency plans for EMR backups and things like that, but we haven't really spent a lot of time making a plan, or most facilities haven't spent a lot of time making a big contingency plan for their revenue cycle. We've seen in the midst of this tragedy that we've been offered very little help from change in United Healthcare. I think United Healthcare has come out with a very small prepayment stipend that they're willing to send providers, which I've heard is almost a joke because it's such a low amount. It's not really anything to help some of these particularly small providers that are now unable to meet their payroll because their claims have stopped coming in. The government has been relatively silent. HHS did finally come out and ask the Medicare Advantage plans to be a little bit more lenient, but there hasn't been a lot of noise in Washington about addressing this or helping the hospitals address this. So I really think that it points out the need to, make our own internal plans in case something like this happens. The big thing with this particular issue has been the ability to process claims. Having backup paper claim methods, I think, is something that we need to, as I said before, we have contingency plans on our EMR that we use to, if our EMR goes down, we have the contingency plans in place to go to paper backup. But a lot of times we haven't gone through and thought about that for billing. We have now in the last couple of weeks, but prior to that. So if you're unable to submit claims electronically, what is that paper plan? What does that look like? Does it include, digging the red and white printer out of storage? Like what can be done now to prepare for that? Another thing is that when my clients reached out to payers in particular, the payers were telling them, hey, you need to go, go through our portals. Well, a lot of them hadn't logged into the portal in a while, weren't familiar with the portal. So there was a huge learning curve in trying to even figure out how to use the portal, which I think has shown the need to make sure that you have somebody logging into those portals monthly, understanding them, understanding how they work, understanding what may be done, potentially submitting some claims through the portal every month, even though you have a clearinghouse, just so that you have a process in place. Some of these portals, you can use bots to submit claims. So I've seen some clients or heard of some clients that are now going to do a small number of claims with bots through the portals every month, just so that if something like this does happen again, they have the ability to ramp up the bots and ramp up the processing. So just things like that. I think it's also really clear right now that healthcare is a huge target for these hackers. Both, obviously Change and United and these big ones, but I think hospitals are a target as well. So, and anything you can do to ramp up your IT infrastructure, protect your IT infrastructure, protect your data, I think is going to be really, really important in the coming years, where we see cyber attacks being used as more and more frequently to disrupt the operations of healthcare providers.
So, yes, going along with what you said, I was at a conference earlier this week, and I believe that they said United offered maybe $2,000 per month out to try and offset this, which is laughable at best. But I know that most of what the payers are claiming is that the hospitals or the pharmacies, the physicians are not their clients. The patient is essentially their only client. So could you just touch on, for these type of business interruptions, how can that be addressed in contracting? I know that you've worked with a number of clients throughout the country as far as trying to set up best possible scenarios for them. So looking at this type of business interruptions, and like you said a minute ago, that you believe that healthcares are just going to be more subject to attacks like this, what do you think can be done from a contracting point of view that is going to help these facilities out?
Yeah, so I think everybody learned the word force majeure back in 2020 when we had COVID happen and we had all of this interruption to business and things across the country and contracts. Most contracts contain what's called a force majeure clause. Force majeure is actually a French word that means unforeseeable circumstances. So that that clause in the contract has kind of always been added just to say, like, hey, if a natural disaster, if like the worst of the worst happens, you no longer are required to, comply by the terms of this contract. There was a lot of litigation and discussion post-COVID if a pandemic fit into the force majeure definition. And in response to that, we have added pandemic language to the force majeure clauses. I think this goes to show that if you haven't already, you need to add cyber attack language to the force majeure clauses just to assist you in the case that you can no longer, operate under the current contract and you need some help. Some other things that we need to talk about adding is specific processes for emergency claim submission. So going ahead and agreeing with the payer beforehand, hey, if there is a cyber attack, either you have a cyber attack, I have a cyber attack, the vendor has a cyber attack, this is how we're going to process claims. So whether that's agreeing to a paper claims process, whether that's agreeing to a portal process, whether that's agreeing to some sort of batch processing or estimation based on past revenues, just really going ahead and trying to agree in writing that, hey, if claims processing slows down for whatever reason, this is how we're going to address it. Because as you said, Matt, that's what's happening right now is the payers are just kind of throwing their hands up and saying, this isn't our fault that your clearinghouse doesn't work. We don't care, which is probably a little bit of an overgeneralization, but I haven't heard any stories of payers really coming out and wanting to assist providers in getting through this. So I think it's really important that, during contract negotiation, if you have a health insurance contract coming up for negotiation, that you're really putting, processes in place to agree to this paper process or a different claim processing backup. Extending timely filing is going to be a big deal. Again, I think that if there should be a clause in the contracts that says if claims are unable to get out the door for whatever force majeure reason, that timely filing is extended for a certain period of time. We saw this, we needed this in COVID, we need this now. When our normal operations are interrupted, it's very hard for hospitals to meet the timely filing deadlines. And it's unfortunate that the way the contracts are written now, that means the hospitals are not going to get reimbursed for those services, even though they did provide them. So hitting those timely filings. And then the other thing that we've seen is the ability for providers to get registered relatively quickly if they do have to change clearinghouses. Just whatever they can do whatever they can do and put in the contract to agree to. But as I said, that contingency plan, that you develop internally, it should correlate with a contingency plan that you've already pre-developed with the payer, because it could be the payer that goes down next. Like right now we've had hospitals be unaffected. I think, United was down for a while with the change things, but if another payer is hacked and they go down and they're a large payer, or even a federal payer, say Medicare gets hacked, and Medicare's down, those are going to cause huge issues that we need to realize that this is the world that we live in now. And we need to see if we can protect ourselves as much as possible moving forward.
Well, I know you just mentioned, protection as well as contingency plans. We are kind of right up against our window here. So are there any last thoughts on what revenue cycle leaders can learn from this situation and how to better prepare themselves for the future?
Yeah, I mean, I think, like I said, crisis management plans, they need to be broad scope to affect all disasters. We have crisis management plans in hospitals and in the revenue cycle for other things, other contingencies, and, they just need to be broad enough so that if something like this happens, again, we know exactly what the plan is. We know exactly who we're going to call, who's going to be put in place, who's on point. I know I've worked for organizations that have contingency plans around hurricanes or hurricane warnings or things like that. Like, this is really the same thing. If we think this is happening or we know this is happening, then we need to be able to immediately set a plan into place to manage that crisis. It's always hard to, respond when you're in the middle of the crisis, as I think a lot of providers have learned over the last 30 days. So whatever kind of plans you can put in place now to be ready the next time this hits, because this will happen again. That's just the world that we live in now. Just like, there is a chance that we will deal with another global pandemic, because that is the world we live in. So we can't, take a deep breath and say, oh, we made it through this, and not take any lessons. I think it's also really important, particularly for hospital CFOs, to accurately assess and prepare for what a cyber business interruption would look like. I don't think that's something that we have really looked at in the past, but this is a perfect, example and data element for us of what does happen if there is a cyber business interruption. And if there is, do we have the ability to insure against that? So there is different forms of business interruption insurance. So really just checking to see what the clauses in your business interruption insurance say and what can be used to extend the ability to use those coverages in a situation like this if you are unable to meet payroll because you're not receiving your payments. And then the last thing would be, you really need a plan. Another, tip from a CFO level is you really need a plan to develop, accurately document your financial loss. Because there's a lot of loss associated with this that is not obvious on the face, right? It's the amount of extra time and overtime we've used. It could be postage if you're submitting claims via paper. It could be bots if you're having to filter to bots. Like I said, there's going to be a cost associated with readmissions. There's going to be a cost associated with delay in care. There's going to be a cost associated with denials due to lack of timely filing. There's going to be a cost associated with denials that we haven't known were outstanding for 30 days that we're now going to miss our timely filing on. So just really trying to figure out internally, how do we document what this cost is if we do need to file an insurance claim, or we do need to be prepared for this in the future, because, unfortunately, I don't think this is going to be the last time.
Well, it sounds like it's going to be a continuing trend, and I appreciate all of your insight on this matter. For those providers or facilities that are listening in, if you'd like more information or like to have an individual conversation with Elizabeth on this, we can be reached at our website, altumhs.com, or she can be reached directly at erichards@altumhs.com is her email address. We'd like to thank everybody for participating today. Certainly like to thank you, Elizabeth, for sharing your expertise on this subject matter. And we look forward to having you come back next month for our second deep dive with Altum. We wish you all a happy weekend. Say that one more time.
I said April 19th.
April 19th, yes. All right, so thank you so much for joining. Happy weekend, and see you guys soon. Thanks so much.